What's up guys, Dr. Salham here. Today we're going over some self-treatment exercises for mild to moderate scoliosis. All right, so what is scoliosis? Slight curvature of the spine. Sometimes you'll see yourself presenting like this, uneven shoulders, uneven hips, curve of the spine. You might have your doctor or doctor of physical therapy diagnose you with something like this, and here's a few exercises you can do to help yourself improve your posture and decrease your risk for scoliosis problems long-term down the road. So let's get to it. If you've been diagnosed with some mild scoliosis, or if you're worried about your posture being so bad from maybe sitting at a desk, being in school all day, looking at your phone, things like that, here's a couple exercises. And like everything in life, we start from the ground up. So I like to start on the stomach here. You're just doing your basic Superman pose, okay? Trying to raise up, arms straight up out in front. You can come this way. Try this 10 times in a row. You can go thumbs up, make a Y here. Try this 10 times in a row. Okay, I also like to go hands back, pinkies up, and we're raising here 10 times in a row. Okay, we're trying to strengthen our back extensors and improve our postural strength and endurance so our spine can be supported throughout the day. Now once you get those down, I like to progress it to hands back out in front, marching opposite arm, opposite leg, back and forth. Trying to really pause, slow and controlled. You shouldn't be flopping back and forth. From here, we progress to quadruped position, hands and knees. Start with one arm straight out in front and just try to hold it for 10 seconds, okay? And then you're going to go to the other arm, try to hold it for 10 seconds. Once you get those down, alternate until you can hold this for 10 seconds. Both sides, we want to keep things symmetrical, especially since scoliosis causes us to have asymmetrical curvature of the spine. All right, and then from there, you can progress it, coming all the way in, all the way out, okay? Or you can march back and forth. Simple exercises like that done every day, about 10 times each, is where you start to begin to improve your posture and decrease the curvature of your spine and improve your overall health. Now, if you can get your hands on a Swiss ball, stability ball, something like that, you can bump up those exercises from the floor on your stomach to the quadruped. And then I like to throw this guy in there with a lot of people I work with, okay? Now these exercises, again, are for mild to moderate scoliosis, okay? So same exercises you just did, but now we're trying to use a stability ball. I keep my legs spread out, okay? So I have a little bit more balance and stability, okay? And then from there you can progress to kind of like our quadruped position. Stomach is on the ball in the middle. You're going opposite arms, opposite legs, trying to march it back and forth. Hands behind your back. This works more of your lower back extensors. I like to use TheraBands. So there's a ton of different brands out there. Rubber bands, basically. Find the strength that you can do this with. Nice tall posture. Notice how I'm not slouching and doing it here, okay? And I'm not falling backwards. I'm sitting up nice and tall, best I can. My arms are pretty straight and they're pulling all the way out, pinkies on the outside, all the way to my chest. And then I squeeze my shoulder blades together at the end, okay? So we're coming nice and slow and controlled, okay? You shouldn't be snapping back or anything like that, okay? It should be right here, slow and controlled. Hold it there. Try to get 10 of them if you can. And at the last one, pinch back, hold, nice tall posture, head up, breathe through your nose, out through your mouth. Try to get 5 good breaths there while maintaining that posture, all right? So from the side, you can see here, I'm coming here and coming here. Now, if I have a kyphotic posture, it's gonna be a lot harder to do these things. So we need to work on some of our mobility before we can even do this exercise properly, okay? So you need to be able to come up tall and come here. You can still try these exercises, but start from the floor, work your way up to some of this stuff. Another exercise I have a lot of my patients, athletes, everybody kind of work with is maintaining upright posture here. So we came here already, right? So this one you might need a lighter band with. So you're coming up overhead. Try to get up as far as you can. Now, if you have kyphotic posture or scoliosis, it's gonna be tough to do that. So again, you might not be able to do this perfectly at first, but as you improve with those other exercises, you will get this one down. So we're coming up all the way over our head and we're pulling out, and then I want you to try to pinch your shoulders down, okay? So here I go. I pull out and I try to bring it down a little bit right there. Back up overhead, pull out, pinch down, okay? And here, I try to hold this and maintain it, head up posture. And I try to see if I can walk and move, do different exercises while maintaining that position, okay? As we improve, our endurance gets better in our muscles, our strength gets better in our muscles, and some of that curvature can be corrected over time. It takes a lot of work, daily practice, being mindful about how you're sitting at your desk or your table where you do your work. All right, guys, so those are some basic things you can do to help prevent some scoliosis, some poor posture, if you've been diagnosed with it from mild to moderate. Now, if it's severe scoliosis, we have to consider other factors, meaning with your doctor, you'll have x-rays scheduled, possible surgeries. This kind of stuff is some self-treatment for some mild to moderate stuff that you can do outside of your physical therapy and things like that. So some things to think about, and the reason why we do these things is if it progresses too far and our spine actually does move, you'll not only, your appearance will be asymmetrical, which isn't fun for anybody. Nobody likes to look a little different side to side. You want to have both shoulders even, hips even, not funny like that or anything. And then you also want to think about, okay, if my spine is curving, the amount of lung space that I have is going to decrease, okay? So your breathing will become more difficult, higher risk for lung type infections, things of that nature, okay? So those are a couple things to consider. And then also with the spinal curvature, as it curves down, you see right here, we'll pretend this is a vertebral column, this is a vertebral column. If it curves too much, you'll notice that space in between the spine right there decreased. And what comes out of those spaces is our nerves that comes to the rest of our body, our limbs, right? So if you decrease that space, you have a chance of maybe pinching those nerves and having some nerve type problems down the road, whether it's in your lower or upper extremities, depends on how your scoliosis presents. That's it for today. Just some mild to moderate scoliosis self-treatment exercises. We do this to maintain, good posture, symmetrical look, keep our lung function healthy, keep our spine and our nerves healthy, and we don't want to have any problems down the road from this type of stuff. So while you're young, take care of it. Do these exercises every day. Try to work your way up to sets of 10, maybe holding posture or poses for 10 seconds at a time, and these things will help you down the road. Some easy treatment stuff. Remember, it's free. All right, let's get to it. Dr. Solham, out.